Hello, my name is Gilles Salles from Memorial Sloan Kettering in New York, and I'm happy to discuss with you this morning the insights that we're providing during the spring meetings regarding the activity of the combination of polatuzumab vedotin with rituximab-CHOP in patients with diffuse large B-cell lymphoma overexpressing BCL2 or MYC proteins. As you know, in the POLARIX study, we evaluated in a randomized way either the standard of care CHOP or polatuzumab vedotin combined with R-CHP, omitting vincristine from this experimental arm, which we call now POLARIX. You know that the study has demonstrated a significant PFS benefit for those patients receiving POLARIX as compared to those receiving R-CHOP, with an absolute improvement of PFS of 6.5% at 2 years, and in other words, a reduction by 27% of the risk of progression of death for those receiving this combination. So when we look into large subgroup, which were those of patients overexpressing BCL2 protein, MYC protein, or both, we were interested to understand if this new combination may potentially improve the outcome of patients with some of these abnormalities, knowing that in many former studies, it was always recognized that the overexpression of BCL2 was associated with a worse outcome for patients with DLBCL, and that these patients called double expressor lymphoma, those that overexpress both BCL2 and MYC, also had a more unfavorable outcome. So what we found in this predefined analysis was that the addition of polatuzumab or the POLARIX combination, in other words, was significantly improving the outcome of patients overexpressing BCL2, and that with this combination, the outcome of these patients actually is similar to those patients without the overexpression of BCL2. And this is a large group of more than 200 patients. And for the patients which were double expressor, expressing both BCL2 and MYC, there was also a correction of this adverse outcome of this patient, and this patient not grouped together to the patient without overexpression. So this is an important finding showing that this new regimen, POLARIX, is significantly improving the outcome of those patients with the poorer prognosis in DLBCL. These are a large group of patients. We had also some look about patients having BCL2, MYC, or BCL6 translocation, but the number are rather small. When we look at isolated translocation, there seem to be some benefit in all this subgroup also, while when we look at patients so-called double hit, the confidence intervals are extremely wide, and it's difficult to ascertain whether there is or not a benefit from POLARIX for this patient. But again, in summary, in contrast to all other studies evaluating the outcome of patients overexpressing BCL2 or BCL2 MYC, it appears that the combination of POLARIX is able to reverse the negative impact of this biology in diffuse large B-cell lymphoma, and then a reasonable approach for this patient. I think we'll definitely hear more for the result of POLARIX regarding molecular data in the future, and we look forward to better understand how this new regimen can improve the patient of certain subgroup of patients with diffuse large B-cell lymphoma. Thank you for being with us today.